months, results show residents are still in desperate need of soap or hand sanitizer, coupled with inadequate access to water in metros like the city of Johannesburg, the city of Cape Town and city of Asivikelane. Informal settlements are hotspots for infection because they don't have enough taps and toilets, and these communal facilities are not cleaned often enough. To talk to us more about this, we're joined via Skype by Planact and Asivikelane Initiative Programme Coordinator Shumani Luruli. Shumani, a very good morning. Thank you so much for taking the time to talk to us. So you're asking that masks are accessible, but you're saying that masks are accessible, but basic services are still problematic. Just unpack the problems faced by people in informal settlements for us.
Good morning, Desiree. Thank you very much for having us as the team in your program. Let me maybe start by saying Happy Women's Month.
Oh, thank you.
Yes. Yes. What we see in the areas that we are working, especially informal settlements, is although people have said to us in our report, we do have masks. Some of them are saying we don't have enough soap for ourselves and our families. But what we see and what we are saying in this report is to say basic services are still a problem. I'm talking about informal settlements where people rely on using communal taps, communal toilets. You would remember that most of the informal settlements have got toilets that are temporal. Your mobile toilets where they are lined up on the street and everybody can use. But what municipalities are saying, they're saying they say when they are providing one toilet is for 5 families. So that is what is a problem. That's why we are saying basic services are still a problem.
How can taps and toilets, along with regular cleaning of these facilities, be a solution to the problem?
It is a solution, and the solution that we are calling for is one family, one toilet. Because I mean, some of us who are in affluent suburbs, who are in townships, we have got toilets in our own yards. And here what we are talking about, we are talking of toilets that are lined up on the street, toilets that a lot of people have to use. We are talking of communal taps, as I've alluded to, that everybody has to use. Sometimes we are talking of JoJo tanks, where trucks have to come and put water. And because the delivery service is very erratic, people don't know when next will we get water. You find people rushing to one tank and scrambling to get water and not even wait for it to put water in that JoJo tank. So you will find people shifting and moving and shoving each other. And the whole issue of social distancing becomes a problem. So we are saying if people can have taps in their yards, if they can have toilets in their yards, that's the solution we are talking about. Because if you say social distancing, we no longer have a problem of people queuing for the toilet or queuing for the taps, which is communal.
Yeah. At the beginning of the outbreak, both the presidency and the Department of Human Settlements and Sanitation and Water Affairs announced several projects in terms of the provision of these services. Have these promises been met?
Yes, I can say, but there is still more to be done. They can do better. We have seen in other areas where we have indicated that water is scarce, and the department has provided the JoJo tanks, as I've alluded to. We have seen in other areas where we have indicated that water, the taps are running dry. We have seen them trying to increase pressure to the taps. And there are other areas that they are putting new taps. They are making sure that people have access. We have areas where, since we started with our campaign, as you can see that this report, Asivikelane, it's number 9. Since we started from number 1, we have seen gradual and increasing provision, but we are saying we can do better. Government can do better, and we have seen that they are capable.
So
Thank you.
what is the way forward? How are you interacting with government in making sure that all of these demands that you're making are met?
Luckily, this COVID-19 found us already with a bit of relationships with different metros and different municipalities. And also the COVID-19 teams that the Department of Human Settlement, Water and Sanitation has set up. We have our director sitting in that team, and they do give a report every time in that team. And issues that we are raising from Asivikelane campaign, they get to go in there, and metros hear about it, and the department hear about it. And within the different municipalities and metros, especially, we do have officials that respond to our reports. Hence, I'm saying we have gradually started seeing development and started seeing improvements.
Well, let's thank you for talking to us today. We hope that you will achieve the improvement you seek to see.
We definitely hope that. As Planact and other organizations, we are putting together posters in different areas, in different communities, especially informal settlements, to educate and conscientize people about the virus, and to also encourage them to social distance and use these services together. Thank you very much. And thank you to South Africa, who are trying very hard to stay safe.
And thanks for the amazing work that you do, Shumani.
Thank you.
Shumani Luruli is the program coordinator for that program, enact.org. Let's remind you of that question we're asking you today on the 1st of August as South Africa starts National Women's Month. Have South African women raised their voices sufficiently in the fight against COVID-19? Let us know at the agenda_SABC. We'll take a look at your responses in a bit. Let's take a break for now.